Ayurved, Etymology and Definition. The word Ayurved consists of two parts, viz. Ayus and Veda. The latter word has been derived from the root vid, meaning to know, to understand. So, Ayurved is something by which we know or understand Ayus. Vid has another meaning, that is to gain also. Considering this meaning, Ayurved would mean something by which we gain Ayus. Vid has a third meaning, viz. Presence. So, Ayurved is something which has a presence of Ayus in it. After having known the various meanings of Vid, let us now consider the first word, Ayus. Ayus is the samyog of four factors: Sharir, Indriya, Sattva and Atman. Sharir, body; Indriya, senses; Sattva, mind; and Atman, soul. According to Ayurveda. Now, Sanyog means coming together or conjunction of these four factors. So, Ayus is something consisting of these four factors together. This very definition of Ayus is quite different from the present concept of life which we learn. That is why I tried to avoid using the word life for Ayus initially. While we consider the life from the unicellular organism like an amoeba to human beings, we mostly emphasize on the bodily activities. Very little consideration is given to the mind, the feelings of living organism. Sir Jagdish Chandra Bose received a Nobel Prize for proving the feelings of the plants. We the humans, though we know about our feelings, pay very less attention to these while considering the health problems. I would like to explain this with the help of a case. A woman aged 27 approached me for treatment. She was suffering from severe backache. She was examined thoroughly and was found to be having some defect in the vertebral column, and so was advised surgery. She came to me to find any solution without surgery. I examined her and asked a simple question: when the pain starts or with what it aggravates? Surprisingly, the answer was spontaneous and simple. When I start thinking, naturally, my second question was, what do you think about? Then she told her story. She belonged to the Khoja caste and was the fifth wife of her husband. She got married at the age of 12th and conceived first child at the age of 13th and second at the age of 14th. She was sterilized and divorced at the age of 17th. She came back to her poor parents, could get some job and started living with them. I said, this is an old story now. You have already lived 10 years after that. What makes you unhappy now? Then she said that she met her children accidentally in a ceremony and had an immense feeling of having at least one of them. The backache started with this thought. Having realized the only psychological cause of her illness, besides giving her some medicines, oil massage and steam bath for immediate relief, I mainly emphasized on basic thinking. She urged me to suggest something, as she had been thinking for a long period without any positive outcome. Then I asked her to think of three alternatives. 1. Sue her husband and try to get the possession of at least one child. 2. To marry somebody else and try to reverse the sterilization operative. 3. Forget everything and start living the life as she was doing previously. Within 15 days, she could determine to select the third option and could remain firm about it. She was totally relieved from the pain and didn't suffer from that since last 20 years. This example very well explains the role of mind in various diseases. We find that stress, worry, anxiety, etc. do cause serious diseases like cancer, heart disease, etc. and have to be dealt in with treatment necessarily. Stress, depression does aggravate the disease, making it incurable, whereas positive attitude, belief can alone even cure a serious disease. Peculiarities of Ayurveda. The existence of Ayurveda over thousands of years shows that it is time tested and has got a very firm base. Here we consider its peculiarities. Basic principles of Ayurveda. Unchanging basic principles is one of the important peculiarities of Ayurveda. It's basically the theory of dosha, supported with other theories. Vata, Pitta and Kapha are three dosha, which are the basic constituents of the body. In a balanced state, they maintain perfect health, whereas their imbalanced state leads to diseases. The disturbance may occur due to food habits, behavior, and time factor, such as seasons, psychological factors, etc. Those have a direct relationship with the basic five elements such as Vata, Vayu and Akasha, Pitta, Tejas, Kapha, Prithvi and Jal. Depending upon the similarities with the causative factors, a particular dosh gets increased and causes diseases due to imbalance. With the help of proper measures through diet, daily regime, psychological factors and meditation and medication, the balance is to be restored. We now turn towards the next peculiarity. Individuality. This is another important peculiarity of Ayurveda. Nowadays, we speak in terms of the masses. We have it is statistically significant data neatly analyzed to draw certain inferences. For example, occurrence of such a disease in a particular country is so much percent, etc. This does give a general guideline about the probability of diseases, its probable causes, etc. But when we start thinking of treatment, except epidemics, we are thinking individuals and not really masses. Let us try to understand. Actually, formation of a disease is a complex phenomenon. There are so many factors involved. The manifestation of the disease changes according to the quantum and quality of these factors. Let us take an example of bronchitis. Now, according to Ayurveda, this is mainly related to kapha and vata dosha. Now, the causes of 10 patients of bronchitis may vary from patient to patient. For example, the cause of the increase of kapha dosh may be consumption of sweets like chocolates in one patient, may be jams and jellies in another, may be ice cold water, ice creams in other one, may be fruits like banana in some others. Smoking might be cause of bronchitis in some other patients. Irregularities in food habits leading to disturbance of vata dosh may be a cause in some patients. The quantum of the causative factor may also vary. One may be consuming 2-3 chocolates a day for years, whereas others may be consuming 1 to 2 per day for a few months. The sign and symptoms, the longevity of the disease may also vary from person to person. According to Ayurveda, the basic constitution of an individual is also different. Depending upon what one inherits from one's parents, how one behaves in one's life, what one eats, how one thinks, etc., the formation of disease in a particular person can be known. Since this varies from person to person, the treatment is also personal. Actually, the patient is interested in his disease and its treatment. He is not really benefited from the information of the occurrence of his disease or the efficacy of a particular treatment of that particular disease. Holistic approach. The holistic approach of Ayurveda is well known and is being discussed all over the world. Let us consider it elaborately. Our body mechanisms are very much complex. Modern medicine is very much successful in analyzing the body parts thoroughly. Huge information has been put forth by modern medicine with the help of microscopes, X-rays, ultrasound mechanisms, CAT scans and MRI, etc. It has become possible to visualize many internal organs with various super sophisticated techniques. This has given rise to specialties and super specialties and also a fragmented approach towards a disease. One thing is certain that modern medicine has put forth a particular cause-effect relationship in certain diseases. But in many cases where the disease is psychosomatic or associated with the change in the lifestyle, modern medicine just concentrates on symptomatic relief, at least on a practical level. This is because very recently modern medicine has started to think about changing lifestyle and psyche as the root of diseases. As a result, modern medicine relies on bodily pathological examinations and manages symptomatic treatment accordingly. There are so many specialties in modern medicine like cardiology, neurology, gynecology, dermatology, oncology, etc. Depending upon the signs and symptoms of the patient and findings from the investigations, various experts are called to treat a particular patient. Everybody gives his treatment leading to chaos. In earlier days, the concept of a family physician was deeply rooted in the society. The family physician used to know not only the present signs and symptoms, but also fully familiar with history, personality to some extent and thus could give some comprehensive treatment. People had very much faith in him, and unless and until he advises, nobody will go to another physician or specialist. But with the development of modern sophisticated techniques and super specialties, the whole picture has changed or is changing very fast. People on their own try to find specialists or they are referred to them. When a patient is admitted in a hospital, hospital management itself seeks the opinions of various specialists. This gives rise to fragmented approach towards the disease. As against this, the Ayurvedic approach is holistic. Ayurveda emphasizes on a detailed history of the patient with various angles, such as what the patient has inherited from his/her parents, where he/she was brought up, what is routine diet in that region, what are the common diseases in that region, what is the daily routine of that patient, what is his constitution, what are his problems, what does he think about, what are his past illnesses, etc. This gives a complete picture of the patient and provides guidelines for treatment. Since Ayurveda considers every aspect of life, nothing is probably left out. I would like to quote a few examples. A case was reported to me for allergic urticaria. He was suffering from his disease for last 5 years. He has to take an anti-allergic every day. When I took the history, I found that originally he suffered from hyperacidity and was being treated with antacids for 5 years. The symptoms like heartburns, headache stopped after that, and so the treatment of hyperacidity was discontinued. Later on, after 5-6 months, he started suffering from urticaria and was being treated with anti-allergic. Then what I found was the treatment for hyperacidity and urticaria was only symptomatic. Nobody had bothered to examine the lifestyle and correct it. As a result, the root cause, that is, dosha, according to Ayurveda, changed only the form of the disease, as they were really not dealt with. Curds, pickles, spicy non-vegetarian food were the causes for the disturbance of pitta leading to both the diseases. I advised him to change the lifestyle and food habits. He got cured from both the diseases once for all through proper treatment. Another case was reported to me for the loss of weight and intermittent loose motions. This patient didn't respond very well to my treatment. I kept on asking for any psychological ailment, and then he said that he has a fear in mind that he is suffering from cancer. I tried to convince him that it is not so and he should stop worrying unnecessarily. But he couldn't realize. Ultimately, he was subjected to all investigations and to liver and bone marrow biopsy, and it revealed that he doesn't have cancer. The patient then improved miraculously.